Have you ever experienced a night where it was incredibly difficult to fall asleep? Has this been a recurring problem for you? If so, then pay close attention to this video, because we're going to delve deep into the topic of insomnia. Insomnia is, in fact, the most common sleep-related complaint among the general population, affecting up to half of adults at some point in their lives. We typically see insomnia manifest in three distinct ways. Firstly, it can present as difficulty initiating sleep, where an individual lies in bed and struggles to drift off. Secondly, it might appear as difficulty maintaining sleep, meaning a person falls asleep, but then wakes up in the middle of the night and finds it hard to return to sleep. Or thirdly, it could be characterized by waking up much earlier than desired. Someone who used to sleep until a certain time suddenly starts waking progressively earlier, even if they could and wanted to sleep longer. You likely know many people who have experienced one of these three issues, or perhaps you've encountered them yourself. But when does this become classified as a sleep disorder? For it to be considered a sleep disorder, beyond these complaints, two crucial factors must also be present. First, it must lead to some form of impairment or impact during your waking hours. Second, this difficulty sleeping must occur in an environment that is conducive to sleep. Let me explain this further. It's quite normal not to be able to sleep if, for example, your neighbors are having a loud party, a dog is barking incessantly, or the environment simply isn't favorable for sleep. In such cases, no one would label this a sleep disorder. However, if you are attempting to sleep in a quiet room, with an appropriate bed, a comfortable mattress, a supportive pillow, and without light or noise, and you still struggle, then we can indeed consider this a sleep disorder. Furthermore, insomnia must cause some detriment to the individual during the day. This could manifest as fatigue, persistent tiredness, difficulty concentrating, memory problems, excessive daytime sleepiness, or a range of other issues that stem directly from the struggle to get adequate sleep. If you suspect you might be experiencing a sleep disorder, there are some important pieces of information you should share with your doctor. For instance, how long has this been happening? Have there been any recent changes in your daily life that might be contributing to your insomnia? Acute insomnia, which lasts for less than 3 months, generally has a clear trigger. There's often a specific factor or stressor that is causing the difficulty sleeping. It's worth noting that stress isn't always from negative events. Sometimes positive stressors can also trigger insomnia, such as planning a wedding or anticipating the birth of a child. Other factors can also initiate an episode of acute insomnia and become significant in perpetuating it, causing it to transition into chronic insomnia, which lasts for more than 3 months. Some factors you should be aware of include psychiatric issues like anxiety and depression, neurological conditions, heart problems, respiratory issues, thyroid problems, both hyperthyroidism and hypothyroidism, and chronic pain. All of these can either cause or be a consequence of insomnia, leading it to persist. Consider your habits before bedtime. Do you typically drink coffee in the evening? Caffeine is a stimulant that can severely disrupt sleep, and it's not just found in coffee. Other stimulating beverages like black tea, Métis tea, green tea, sodas, and even chocolate can interfere with your ability to fall asleep. Another important consideration is alcohol consumption. Sometimes people mention having a nightcap to relax and help them sleep. The problem is that over time, alcohol can not only lead to dependence, but also cause what we call rebound insomnia, where you wake up in the middle of the night and struggle to get back to sleep. Think about your daily activities that you might be doing in bed, things like watching TV, browsing the internet, working, or studying. All of these are activities that can be incompatible with sleep and disrupt your sleep patterns. It's also crucial to observe if you're extending your time in bed unnecessarily. Often, to compensate for a poor night's sleep, people go to bed earlier or stay in bed later, hoping to catch up. However, when you do this, you're actually training your mind to associate the bed with being awake and worrying, rather than with sleeping. Do you tend to take naps during the day to make up for a night of insomnia? In reality, what you're doing is stealing hours of sleep from the following night. By napping during the day, you're essentially getting a portion of your sleep during daylight hours, only to find yourself struggling to sleep again at night. Many times, in the pursuit of improving insomnia symptoms, people inadvertently put themselves at risk by self-medicating. One common issue is the use of prescription sleep medications or benzodiazepines without proper medical guidance. We know that the unsupervised use of these medications is associated with a range of risks, including dependence tolerance, where the medication loses its effectiveness over time, increased risk of falls, and a higher risk of developing cognitive issues like dementia, memory problems, and difficulty concentrating earlier in life. So, if you are struggling with insomnia, please do not self-medicate or take medication prescribed for others. The best course of action is to seek medical advice, as there are various types of insomnia, and the most effective treatment will be determined in consultation with your doctor. This is Robert Miller from Young Forever Health, and our goal is to empower you with well-informed choices for your health. Have you ever been advised to take a warm bath in the evening? Does it actually help? When we sleep, it's normal for our body temperature to drop. Taking a warm bath raises your body temperature slightly, and then, as it cools down afterward, this drop can aid in inducing sleep. However, a very hot, scalding bath will raise your body temperature too much and can actually hinder sleep. A very cold bath also causes your body temperature to drop too rapidly. It's important to stay warm, especially your extremities, like your feet. Cold feet can cause a person to wake up, so, for a good night's sleep, particularly on chilly nights, keep your feet warm with a cozy pair of socks. If you're enjoying the content from Young Forever Health, please subscribe to our channel, leave your comments, and like our videos. Most importantly, don't forget to share them with your friends and family.